for inviting me. You'll have on the left side of the rows a piece of paper that sort of looks like this, and you can also scan the QR code on the screen. If you scan this, you will have a copy of all my lecture slides, and so I'll share all of those with you. This way you can have those as we go through today, or if you want them for later on to refer back to. All right? And again, the handout, after you scan it, just pass it to your right so it gets through the entire room. All right, looks like everybody's gotten that. So I gave a lecture on side effects at AADSM in 2022, and last year I did ProSomnus ProSleep. And again, I'm giving it this year, but with a little bit different twist. Some new stuff, of course, and I apologize in advance for anybody who has already saw or has seen those two, either one of those two programs for some repetition, but we can't reinvent the entire program. So we're going to talk about side effects, and we're going to try to cover this in 55 minutes, so I might go 70 miles an hour in getting through it. I'm always noted for doing a lot of slides, and I power through them, and this way, that's why I give you the handout. This way you don't have to worry about saying, I didn't get a picture of that. You have it all for yourselves. And we know that everything has side effects. CPAP and hypoglossal nerve stimulation has side effects. And this was a study done by Len Liptak and Mark Murphy that talked about oral appliances having fewer adverse events. Now, these are more medical events. Things like, if you look at this, for CPAP, different types of problems, respiratory tract infection, hypoglossal nerve. And they said that oral appliances don't have a lot of medical side effects, yet they also noted that the dental side effects with oral appliance therapy is very minimal with respect to any type of major complication. But we're going to talk about these dental side effects. So I want you to kind of think about the minor side effects, things like sore teeth and dry mouth or excessive salivation, because we're going to do a little interactive thing in a few minutes. You're going to also ask you to keep your cell phones out. And then we're going to talk a little bit about the major side effects, tooth movement, bite changes, TMD problems, and muscle discomfort. So let's get those cell phones out now, and we're going to pull up the first thing. John, if you could pull up the first one, you can either scan this, or if you go to your cell phone, go to menti, menti.com, and then there's a top numbers. It's hard for me to read. You see that number? I think it's like 3, 1, 2, and whatever the rest digits are. You enter that in, and then you can answer the question. It's going to populate what you think is the percentage of side effects. Is it 0 to 5? Do you think side effects occur approximately 10%, 15% of the time? So we'd like to see how this is going to start to vote. So as we're starting to vote, you can see it's repopulating. We only have about 6 votes in there. So it seems like some people think that the side effects occur 0 to 5%, and some people are in the 10% range. One person thinks it's more than 15%. So we all have a variation of what we feel the side effects in our practice or what we experience with oral appliance therapy. All right, so it's starting to repopulate. So it seems like right now the 10% is leading the voting. And we'll just give that another half a minute or so. And you can see that not everybody has voted, but of course, feel free to. So it's kind of anywhere between 5 and 15%. So that's kind of cool. All right, so if we can switch back to the presentation. So we don't know that side effects are going to happen. They're going to exist. We have to deal with it. We have to accept it. We're going to have to both treat them, control them, and prevent them. That's the biggest thing. But if they happen, we have to know which ones we want to treat definitively. But the most important thing is, can oral appliance therapy be continued with one of these types of side effects, or do we have to discontinue oral appliance therapy? That's one of the big things. And you'll notice on the slides that you download, there's a lot of stuff highlighted in red. That's more of my key point that I'd like to make on that specific slide. So let's go to the second one. You could leave this up. This is going to be, what is the most common side effect that you see with oral appliances in your practice? So let's get this QR code scanned, and when we pull it up, there'll be that menti.com, and we can see if we can pull that up again. Can we pull up the second one, John? All right. There we go. So what is the most common? Sore teeth, bite changes, TMD, this muscle soreness, tooth movement, staining, biogum. That hasn't gotten a single vote yet. So it seems like bite changes is leading the voting right now. Okay? It's interesting. So that seems to be the winner. All right, let's go back to the presentation. We have one more that we're going to see. So now I put down, what is the most harmful side effect that you think happens with all of those? So we thought bite changes was the most common, or the most that you see most often. And let's pull up the last of the voting. I like to do a little interactive. And again, so what is the side effect you feel has the most harmful effect in oral appliance therapy for you? TMD discomfort seems to be the one that people feel like has the most harmful effect. Jaw soreness, TMD discomfort. All right, it's interesting. Very interesting, because as we go through this rest of the program, you'll see where my theories come. And then we'll go through that. All right, let's go back to the presentation. Thank you all for participating in that. So I have 4 keys to controlling side effects. Being preventative and proactive, education our patients, recognizing them early, and then treating them or managing them. And we'll talk about treating versus managing a little bit as we get to some of these. So what if, this is the new part that I've presented, what if we can prevent some of the side effects, especially the ones that we thought were the most harmful, save variable chair time, and increase efficiency. And there's a few ways I like to do that. If we could take a proper bite, a construction bite, with Echovision and how I do it, and not have to over-advance the mandible, if we can then make precision appliances that are made to our specific bites, and if